short video, I'm going to discuss you the 5 most common questions which are most commonly asked about the liver tumors. Firstly, they would ask you that what is the most common cancer seen in liver? And most commonly given wrong answer in this case is hepatocellular carcinoma, where the answer would be correct answer would be metastasis. Metastasis or secondaries are the most common cancer seen in liver. If they ask you what is the most common primary cancer seen in the liver, because primary means that cancer which is originating from that organ, originating from the liver, then only the answer would be hepatocellular carcinoma. Otherwise, if they asked that what is the most common cancers in the liver, answer would be metastasis or secondaries. And there are a lot of sites from where the metastasis and secondaries can come in liver. Like they can come from the other GIT sites like colon, pancreas. They can come from gallbladder. They can come from lungs and breast. So a lot of other sites, nearby sites or sites at a distance, from there the metastasis can come. And metastasis or secondaries in the liver cancer, they are usually, they show multiple lesions scattered all over the liver, multiple small size satellite like lesions scattered all over the liver. They usually don't present with a solitary lesion, the metastatic lesions in the liver. Grossly, I'm talking about the gross appearance. And grossly, another characteristic feature is central umbilication could be seen. That central area of necrosis could be seen in the metastatic nodules in the cases of hepatic metastasis, the metastasis of other cancers to the liver. Second common question they will be asking you that what is the most common cancer seen originating from the liver? Answer would be hepatocellular carcinoma. Hepatocellular carcinoma I had already discussed in other videos. Third most common question they will be asking you that what is the most common tumor seen originating from the liver? Answer would be cavernous hemangioma. Or this is cavernous hemangioma is the most common benign tumor which is originating from the liver. This is the, because cavernous hemangioma is a kind of vascular tumor. It's a benign tumor. It's typically located beneath the capsule. It has a reddish bluish hue, and the significance of cavernous hemangioma is this, that they are often detected accidentally and they are mistaken as a metastatic cancer. And the second important thing that you should not go for a biopsy in this case, because it's a vascular tumor, could cause severe hemorrhage. So the most common benign tumor, the third key concept is the most common benign tumor we see in the liver is cavernous hemangioma. It's not capillary hemangioma but cavernous hemangioma, cavernous variant of the hemangioma, where we usually see large cave-sized, large dilated vascular channels with abundant stroma. And this kind of hemangioma is known as cavernous hemangioma. And this is the most common benign tumor seen originating from the liver. Fourth question they would be asking you that what is the most common sarcoma seen originating from the liver, or what is the most common mesenchymal origin cancer, which is the other term for the sarcoma originating from the liver. Answer would be angiosarcoma. And regarding hepatic angiosarcoma, you need to keep in mind 3 risk factors which are unique for hepatic angiosarcoma. The 3 risk factors for hepatic angiosarcoma are exposure to polyvinyl chloride, exposure to thorotrust, which was a radio contrast dry agent used earlier, and exposure to the arsenic and polyvinyl chloride, PVC. So these are the 3 things: arsenic, polyvinyl chloride, PVC, and thorotrust. And they also ask that what is the most common cancer seen in originating from the liver in early childhood, usually first 5 years of life. Answer would be hepatoblastoma. So be careful about these 5 questions which are most commonly asked. The most common cancers seen originating from the liver, answer would be secondaries or metastasis. What is the most common primary cancer originating from the liver? Answer would be hepatocellular carcinoma. What is the most common benign tumor originating from the liver? Answer would be cavernous hemangioma. What is the most common sarcoma or most common cancer of mesenchymal origin originating from the liver? Answer would be hepatic angiosarcoma. And please also keep in mind there are 3 characteristic risk factors for hepatic angiosarcoma: exposure to arsenic, exposure to thorotrust, and exposure to polyvinyl chloride. And what is the most common cancer originating from the liver in the early childhood, first 5 years of life, answer would be hepatoblastoma. So these are the key concepts that you need to remember about the tumors originating or coming to the liver. Thank you very much.